get the PPT on email and
हाँ,
probably we will
बिल्कुल,
take it.
that would
ठीक
be
है, I think
best.
we are live. So, good afternoon. Good afternoon, all. Thank you so much again. We are back with another topic, and we have Dr. Vijay Mohan Kohli again with us, a very renowned senior consultant, cardiac surgeon from Fortis Hospital, Gurgaon, and a very learned professional from last so many webinars. We have seen his exhaustive knowledge and the experience he carries. And special thanks to the entire team of Dabur. We have Mr. Anuj with us from Dabur today. So we are very much thankful to Dabur for having these kind of sessions on our platform, because this kind of discussion and this kind of these kind of topics are very important for all the practitioners, for all the practitioners of our fraternity in Ayurveda, which we see very less, by the way, as far as these kind of discussions are there. So we again, without wasting much time, will proceed for the session. I will hand over the session to Mr. Anuj for the official proceedings. And I again thankful to all of you for giving us the support and looking forward to have you in all the future sessions as well. And special thanks to Dr. Kohli for giving his time for enhancing our knowledge. Over to you, Anuj. Thank you.
Many thanks, Dr. Piyush. And from the entire family of Dabur, we would like to welcome all the doctors, Vaidyas, both from the allopathy, Ayurveda, and various other specialities that have joined for this live webinar. We are also thankful to Dr. Kohli for sparing his valuable time and joining us and throwing valuable insights on such a challenging topic like which we are witnessing post COVID much more, right? Brain fog, the various problems with the CNS, right? So, on the topic of dementia, can it be prevented? Dr. Kohli will be throwing his insights. And as we know, that Dr. Kohli is a specialist in adult cardiac surgery with experience of over 8,000 cardiac operations within India and overseas at the University Hospital Uppsala in Sweden. Dr. Kohli has been instrumental in setting up cardiac surgery departments and initiating cardiac surgery in various top-notch hospitals within India, such as Escorts Heart Institute, New Delhi, the Batra Hospital in New Delhi, the Hero DMC Heart Institute, which is in Ludhiana, Sri Balaji Action Medical Institute, New Delhi, and Arneja Heart Institute in Nagpur. Dr. Kohli actively practices and promotes holistic medicine, which includes spirituality, yoga, meditation, and naturopathy, and is very passionate about integrating Ayurveda, naturopathy, and other complementary systems into the mainstream medicine. Dr. Kohli has received multiple honors, including the Distinguished Person Award for the Old Martinians Association in 1999, having excelled in the field of cardiac surgery. Certificate of Merit from the Apollo Hospital, Chennai in 1985 for contribution towards successful completion of first 1,000 open heart surgeries, and Certificate of Appreciations from the Old Martinians Association, Australia in 1999. So, with this brief introduction of Dr. Kohli, may I hand over the session to Dr. Kohli and request him to please throw some insights on such challenging topic. Right, over to you, Dr. Kohli, for the entire presentation.
Thank you so much, Piyush ji and Anuj ji, for your nice words. We'll just go ahead, and this is a very different and as well as a difficult topic which we have chosen for this presentation. That dementia can be prevented. Now, I have given a very categorical statement. That means I'm pretty certain that it can be prevented. May I have the next slide, please? Next one, please. Now, in this slide, you see that uh, very commonly, almost every few days, in members of your family or friends or people in general, you see people forgetting things, you see confusion, lack of focus, concentration, disorientation, brain fog. It has become very common. Now, most of the time we attribute this to advancing age. But let me tell you that these are signs of impaired brain function or dementia rather than age. Next one, please. Next slide, please. Now, what is dementia? This is a pretty confusing term. We tend to think that dementia is a disease. Actually, it is not. It is a combination of many diseases put together, in which Alzheimer's heads the list. It is basically means that there's impaired ability to remember, to think, to make decisions, to plan things in a daily activities. So there are number of them, number of diseases are clubbed in this. Next one, please. Next slide, please. Now, what I want you to note and remember is that even though these problems may manifest late in life, in the 60s or 70s, but things like Alzheimer's, Parkinson's, etc., and most neurodegenerative conditions actually start off in the 20s and 30s of our ages. That means that there's a very long period before it actually manifests. And that is the time when we need to try to correct all this, prevent all this. So please remember that preventing all these neurodegenerative conditions is tantamount to cure. Though, of course, now we have information that Alzheimer's also is being reversed. You'll be happy to know that. Next slide, please. Now, very briefly about the human brain. You know that the brain has a cortex, it has a cerebellum, it has a spinal cord, the brainstem, etc. The cortex is generally related to consciousness, to memory, to awareness, language, attention, etc. While the cerebellum is related to movement, and brainstem is related to our breathing, the heartbeat, blood pressure, etc. Everybody knows that. Next one, please. Now, then we also have what is called the limbic system. The limbic system is the most primitive part of the brain, and this is related to our emotions like fear, anger, pleasure, happiness, etc. This also has a number of parts. Now, any one of these can be affected. That is the reason why I'm mentioning that. For example, the amygdala is related to the point where memories are stored. Hippocampus is where short-term memories are stored. Hypothalamus is related to our emotions, eating, sleeping, etc. And the thalamus is responsible for transferring messages from the spinal cord to the brain. This is a very, very brief aspect of the brain. Next slide, please. Now, this slide is very important because Alzheimer's being the commonest of dementias generally occurs because of there's a communication gap, in the sense that one neuron is not being able to transfer the messages to the other neurons. So if you focus on the picture on the left hand side, you find that these are firemen, and these firemen are there to douse a fire, and they are transferring one bucket to the next person, and the next one transferred to the third, and so on. Now suppose one or two of them were missing in between. So you can imagine that this relay would be delayed or may get lost altogether. This is precisely what happens in Alzheimer's disease. The messages don't get transferred very easily, and which is the reason why people tend to black out and then they take a long time to react. Next slide, please. The basic cause is of all these conditions is excess inflammation. We know that inflammation is important for us, but if there's too much of inflammation, then this inflammation affects every single system or part of the body. But there could be one part or two parts which are genetically weak, like a chain. The chain breaks at the point where it is weakest. Similarly, chronic inflammation, though affecting every part of the body, has mainly it creates problems in the areas which are already weak, genetically weak, or for other reasons, either genetically or epigenetically. If they are weak, then that part breaks down. For example, you can have problems with the brain, you can have problems with the thyroid, it can be any other organ or system in the body. Next slide, please. So chronic inflammation basically is the root of all our brain problems, for that matter, practically every problem in the body. And this chronic inflammation, as you can see, can lead to anxiety, depression, schizophrenia, Parkinson's disease, Alzheimer's disease, ALS, ASD, bipolar disorder, seizures, almost everything. Next slide, please. I'm quoting Dr. Tom O'Brien. According to him, every condition is a chronic inflammatory condition except non-intentional injuries and sodium deficiency in children. The reason why I'm harping on this is that chronic inflammation is now recognized to be the cause of, as I said, practically all chronic disease in the body, and the brain is no exception. And we have to cut this inflammation down, which is why I'm talking so much about it. Next one, please. Now, brain function depends on which part gets affected by the inflammation. So, if a person forgets, then that means that the problem is in the nerve not being able to carry the messages forward. If there's depression, then there's inflammation in the frontal lobes. If there are seizures, then the problem is with the occipital lobes and difficulty remembering newly learned information, then the hippocampus is what is responsible. So, this gives you an idea of where the problem is actually. Next slide, please. So, what causes chronic inflammation? Next one, please. Please move a little fast. Next one, please. Now, to understand this, we have to go back to our roots. And the roots are that, we've been on this earth for millions of years. And before 12,000 years back, we used to be known as hunter gatherers. And hunter gatherers were one who lived off the land. They got up when the sun came up, they went to sleep when the sun went down. They would run a lot, they would eat whatever nature provided them with. They had very good brains, they had no chronic diseases, and they were overall very healthy. Now, come 12,000 years. Next slide, please. As 12,000 years back from now, three things, revolutionized everything: the advent of wheat, corn, and rice. And these we kept eating for a lot of time, and that is the time when our chronic disease started coming in slowly. Then, of late, last 50 to 60 years, we've been ultra processing the food, because of which the blood sugar in the body remains pretty high, insulin remains high, and that leads to neurodegeneration. What the brain needs is healthy fats. Next slide, please. Now, processed foods, of which sugar tops the list, is the main culprit. Of course, there are many more, but this is the main culprit. And there's so many problems with sugar that it is not surprising. I mean, it is actually poison, which is why it was called white death. It is present in all processed foods. It overloads the body. It damages the immune system. It upsets the mineral relationship of the body. It reduces the levels of magnesium. It cuts down the levels of chromium, copper deficiency, etc. And chromium is important for antibody production. Next slide, please. It feeds on cancer cells. It is now known to be the cause, one of the important causes behind cancer: breast, ovaries, prostate, rectum, gallbladder, lung, stomach. It upsets the digestion. It can lead to premature aging. It can change the structure of the DNA, can lower vitamin E levels. Next slide, please. It has been found that those with Parkinson's disease generally have a high intake of sugar, and also sugar can cause epileptic seizures as well. So there's so many disadvantages of sugar. Next slide, please. Then processed carbohydrates. You're already aware that when you eat processed carbohydrates, the sugar increases in the body. When the sugar increases, then there are mood swings, ultimately leading to insulin resistance. Next slide, please. Then, when you have soft drinks, each kind of soft drink has a lot of sugar in it. So beer, packed fruit juices, artificial sweeteners, all of these are processed, and these are very important to cause these type of problems. Next one, please. Other common processed foods are cereals, breads, margarine, spreadable butter, processed flour, maida, white rice, salted foods, chocolate, ice cream, etc. You already know that. I just want you to focus on the pictures. Next slide, please. Then another thing which has come in of late, you're all aware of it, but electromagnetic radiation is very important. It is a very, very important cause of inflammation. It can lead to cardiac problems, it can lead to vascular problems, it can lead to neurodegenerative problems, as well as cancers, leukemias, etc. Next one, please. I'll skip this slide because there's a lot to talk about. Next one, please. Chronic stress is another important factor causing chronic inflammation. Why I'm harping on this is that it is very important to know what the causes of chronic inflammation are, because they lead to all problems, including brain problems. Next one, please. Now, this is a very important concept. Now, basically, it is the gut which is responsible for our brain functions. This may come as a surprise to you. There is a bidirectional flow, and studies show that patients with Alzheimer's disease and Parkinson's disease, their problem begins in the gut. and a large percentage of patients suffer from constipation for years. So, constipation should not be taken lightly at all. It is being identified that all this is happening because of the microbiome present in the gut. And this microbiome is responsible for all of these conditions. Next slide, please. And this is mediated through what is known as the vagus nerve, about which all of you are aware. The vagus, as you know, starts from the medulla oblongata, goes down right to the base of the rectum, and supplies branches to all the systems in between, which means that all systems can get affected, including the brain. So if the microbiome is imbalanced, then the vagus nerve sends messages to the brain, and the brain starts suffering because of that. Next slide, please. So the cause behind all of these things is what is called leaky gut. And leaky gut leads to what is called leaky brain. So these two are very important entities. Leaky gut got to be known in the early 90s, but even now it is not very well understood. Next slide, please. Now, what happens in leaky gut is that the intestine has a single layer lining, and this lining needs to remain competent. Now, they are what in between the cells, the microvilli and the small intestine, they are what are called tight junctions. These tight junctions have to remain tight for the cells to remain together, as you can see here. But if they get loose for some reason, it is like your shoelace is getting loose. When that happens, as you see here, when that happens, then large chemical compounds, complexes, etc., go directly into the bloodstream and cause systemic inflammation. And this can happen because of stress, toxins, food particles, large food particles, pathogens, drugs, infection, etc. Next slide, please. So when this happens, then the brain, also having a similar type of a lining, also gets affected. And then what is called is the blood-brain barrier gets dysfunctional. This is associated with increased permeability of the blood-brain barrier, the breakdown of the tight junctions, because of which substances or chemicals which were not supposed to reach the brain, they also go into the brain, then they don't get filtered out, and depending on which part of the brain is affected, that part starts showing signs of degeneration. So there is the leaky gut, and then there's a leaky brain. So this is the reason how these things actually happen. Next slide, please. Now, what causes leaky gut? You're already aware of that. Most of them are like food sensitivities to sugar, alcohol, dairy, eggs, gluten, GMO foods, grains, legumes, nightshade vegetables, chemotherapy, radiation, surgeries, gut infections. All of these can lead to a leaky gut. If you ever had an immune problem, that means you definitely had a leaky gut. If you have skin problems, then also most likely you had a leaky gut. But certain medications can also do the same, like acid blocking drugs, antibiotics, NSAIDs, aspirin, ibuprofen, prednisolone is a very, very potent cause of this. And especially these COVID days, a lot of people receive prednisolone, which ultimately leads to gut issues and so many other problems. Then mold, mycotoxins, stress. The stress can be physical or it can be emotional. There are so many types of stress. All of these can lead to a leaky gut. Next slide, please. Now, what causes leaky brain? Obviously, the first thing is a leaky gut, then food sensitivities, refined food, trauma, hypoperfusion, that is less blood going to the brain, inflammation from many other sources, production of what are called advanced glycation end products, AGEs. Now, these are abnormal proteins which get exposed to sugar and become overheated. Now, examples are the crust on the bread. Now, this is an example of advanced glycation end products. These go and damage the arterial lining. And also, when you roast meat, then the blackening which occurs is also an advanced glycation product. And all of these are very detrimental. So all of these are actually causing inflammation and ultimately leaky gut. So leaky gut directly or because of any of these factors can lead to a leaky brain. Next slide, please. Now, what causes hypoperfusion? That is low supply to the brain. This can happen because of many reasons. Can be because of heart dysfunction, can be because prolonged bed rest also, diabetes, jaundice, insulin resistance, dehydration, bacterial infections, vomiting, anaphylactic shock. There are many more causes. I'm enumerating only a few. Next one, please. Now, this slide I want you to focus on because even now a lot of heavyweight boxing is going on. It is quite a big craze. Then soccer is a very, very popular game in the US. And some years back, it was learned that 99% of soccer players in the US have severe life-altering and life-threatening inflammatory damage to the brain. Now, this has been labeled as CTE, or chronic traumatic encephalopathy. Traumatic encephalopathy is a post-mortem diagnosis, unfortunately. You cannot diagnose it beforehand, but such patients present with signs of neurodegeneration. And there's a beautiful movie which I've seen on Netflix called Concussion. This goes into all the details of how this was learned and what happens. So, what happens in these conditions is that, as you know, the brain does not have a protective covering. It has a skull, and it is sort of floating in fluid. So, whenever a concussion takes place, then the brain gets multiple hammerings repeatedly. You do a headbutt, the brain gets affected. So all of these ultimately lead to these signs of neurodegeneration. Next slide, please. Leaky gut, how do you know that you have it? Now, there's a big list of these, and I think it is important. All of us should understand, because if we have leaky gut or have had leaky gut, we're likely to have all sorts of problems, especially brain problems. So, if you had an autoimmune problem ever, if you have osteopenia, you have anxiety, depression, bloating, constipation, lot of gas, diarrhea, malabsorption, PMS, perimenopausal symptoms, joint pains, other autoimmune diseases, parasitic infections, SIBO or small intestinal bacterial overgrowth, yeast overgrowth, obesity, diabetes, iron deficiency anemia, acne, eczema, etc. There's some more. I mentioned only a few. Next slide, please. Mercury is another very important factor which has been implicated for both brain problems as well as leaky gut. Next slide, please. Alzheimer's disease, now I'll mention a little about this thing. This is a specific type of dementia in which short-term memory loss gets affected. It starts slowly. It is very, very insidious. It starts with confusion, mood changes, forgetting, disorientation, phobias, difficulty in speaking, swallowing, walking, etc. And of course, ultimately death. As far as allopathy is concerned, there is no treatment for Alzheimer's disease, which is the reason why we have to stop it in its tracks. Next slide, please. So, basic causes are chronic inflammation, lack of brain supporting substances, which also lead to chronic inflammation, diabetes, prediabetes, insulin resistance also lead to chronic inflammation, toxins, which can be biotoxins or metals, and trauma. So, all of these, in a nutshell, are the ones which lead to Alzheimer's disease or any other neurodegenerative condition. Next slide, please. So there are many types. Dr. Bredzen is a gentleman who is the one who has the maximum number of studies related to Alzheimer's disease. He has been instrumental in reversing Alzheimer's disease, and till date, he's done so for over 100 patients. He's based in the US. And he's classified Alzheimer's disease as follows. Type 1, which is because of chronic inflammation. Type 2 is because of not due to inflammation, but because of factors which are helpful for brain function, like vitamin D, estrogen, estradiol, thyroid hormones, etc. Type 1.5 is called glycolytic, and this is because of combination of the above two as well as insulin resistance. Type 3 or toxic because of biotoxins, molds, mercury, other heavy metals, etc. Next slide, please. And type 3 usually presents with visual perception, calculation, or organizing things. You tend to forget all that. Type 4 is because of vascular reasons, and type 5 because of traumatic reasons. So these are the ways Alzheimer's has been classified. And if we know that, then we can take steps to prevent it. Next slide, please. Now, mercury I've already mentioned being important for Alzheimer's. Next one, please. Now, how do you diagnose a problem? Next one. This is important. Now, if you look at the pathological diagnosis or what is diagnostic of these conditions, first is what is known as the amyloid plaque. Now, this amyloid plaque has all along been thought to be the cause of the problem, but this is not the cause, because amyloid plaque, just like cholesterol gets deposited in the coronary arteries, so also amyloid plaques get deposited in the brain arteries, in the brain tissue. Now, they're important because they are there They are antimicrobial, so they are there to prevent a problem. They reduce inflammation. They bind to toxin like mercury. They are very protective, but it is important to find why they have developed. So if you know why they have developed, then you can retrace back and correct those factors which have caused the amyloid plaque. But remember, the amyloid plaque, though still believed to be the cause, is not the cause. It is just an effect of all the problems taking place which are leading to Alzheimer's disease. Next slide, please. What is diagnostic are these tangles. Now, these are twisted fibers of protein which build up inside neuronal cells, and they play a critical role in blocking communication among nerve cells. If you remember in the beginning, I showed you the slide of relay. Now, when tangles are present, they prevent the relay from taking place, because of which the symptoms develop. Next one, please. Now, there's a smell brain. Now, according to the latest research, it is believed that Alzheimer's disease has its origin in the smell brain. That is, the part of the brain related to the nose. That the rhino-sino microbiome is important. The microbiome present in the nasal part of the brain, which is responsible. That is why people who have organisms in the mouth, like P. gingivalis, herpes simplex virus 1, molds, etc., in the mouth, in the nose, all of these have been implicated for production of Alzheimer's disease. Next slide, please. And this is important that the gene related to Alzheimer's is called ApoE4 gene. Now, the ApoE4 gene can be measured. If you have one copy of the gene, then the possibility of you developing Alzheimer's is 9%. If you have if you do not have a copy, then it is 9%. If you have one copy, then it is 30%. But if you have two copies of the gene, ApoE4 gene, then the possibility of developing Alzheimer's is 90%. But let me remind you about one thing, that genes do not write our destiny. They are there. They need to be switched on or off for disease to develop. So if you take preventive measures, it is quite possible you may not develop this disease. Next slide, please. So lots of antibodies are also checked for. I'm not sure how many can be done in India. So you have antibodies to check for damage to the blood-brain barrier, like S100B, NAC, etc. Then you check for zonulin, actin, LPS, etc. You do antibodies for wheat. You do antibodies for gluten and many others. Next one, please. Now, how can we actually keep our brains healthy? This is the main thing we now need to discuss. Next slide, please. So the very first thing is that you got to reduce inflammation. You know that inflammation is the cause, chronic inflammation. So you have to find methods to reduce the inflammation. Therefore, avoid anything which causes inflammation to enter you, either through your mouth, through liquids, or your exposure to certain things. So the very first thing is to avoid imbibing toxins, and next, of course, is to reduce them. So avoid chemicals, plastics, pesticides, pollution, all artificial things which are toxic to us. And there's a big list. I advise every patient to mentally walk through from morning till night what he does at home, what he does when he gets up, how he brushes his teeth, what he does for his mouth, what he does for his how he has a bath or shower, what type of soap he uses, what other chemicals he is exposed to. Everything is important. So anything which is a chemical is harmful to you and will ultimately lead to all sorts of problems, including chronic inflammation. Next slide, please. Pesticides are very important, and man-made chemicals like personal care products, soaps, toothpaste, shampoos, perfume, deodorants, industrial pollutions. All of you know it. We are actually swimming in a sea of pollutants. Next slide, please. So next step is detoxification, and as you know, toxins, which this we have discussed many times, toxins may affect the physical body, they affect the mind, as well as the spirit. So if it is for the physical body, you resort to certain therapies. If it is for the mind, then you go for pranayama, etc. And spirit means meditation. So all of these are important for you. Next one, please. Therefore, detoxification, there are a big list of things which you can do. You can do oil pulling in the morning, which we have discussed before, dry brushing of the body, massaging your body, far infrared or steam baths, using a mud pack, colon hydrotherapy, certain enemas, chelation, high dose vitamin C, Shirodhara is very good, and adequate sleep. This is very important. So this is something which all of you are aware, and this should be done on a daily basis because we are imbibing toxins and getting inflamed on a daily basis. Therefore, as many of these possible should be done every day. Next slide, please. Now, if you have insulin resistance, which many of these patients have, that needs to be corrected and reversed. There is no medicine for that. It has to be done through dietary means. Next slide, please. Then obviously no processed food, no preserved, no fast food, no colas, all have gluten and are harmful substances. Next one, please. The principle management are first you've got to remove everything, then gradually you have to rebuild. There are lots of things that go into this. We cannot discuss it in one session, but basically the principle is prevent getting inflamed. If you have inflammation, you remove all that, then try to build up your body, build up the gut microbiome so that it can combat and reverse your problems. Next one, please. So what to eat? Now, some very important things are there, which I suggest we should have at least some of them on a daily basis. Green vegetables, especially broccoli, cauliflower, spinach, arugula, and cabbage. These are very important because these are these are anti-inflammatory and also prevent cancers. So if you keep having them on a daily basis, a lot of detoxification keeps taking place. Fruits like avocados and berries, they're very potent. Allium vegetable like ginger, garlic, onions. These have a very important role to play. Spices, especially haldi. Haldi is supposed to be preventive as far as Alzheimer's disease is concerned. And eating fermented foods. So this is a very short list, but very important. Next one, please. There are certain things which are very, very helpful. And of these, the most important is colostrum. So if you can't get anything else, but if you can get colostrum, that is extremely good. Now let me tell you that when a child is born, for the first 3 days, the child has a leaky gut. It's only when the child feeds on the mother's breast milk that colostrum enters it. And once the colostrum enters, it seals off the leaky gut. So this is a physiological process. Now colostrum has many other factors. It modifies the genes, repairs damaged endothelium, it repairs the leaky gut. It also, 1/4 of it has total solids which are antibodies like IgA, IgE, IgD, etc. And activates genes that repair the microvilli. The problem is at the microvilli level in the small intestine. So whatever problem there is, the colostrum helps in fixing it. So this is a very, very important method of treating these conditions. Next one, please. Another thing is green tea. Green tea has assumed a lot of importance, and I suggest that at least we should have 1 to 3 cups of tea, if it is possible for you to have that, because it has lots of functions. It is very protective to the blood vessels. It protects damage of powerful drugs, etc. Next slide, please. It protects the brain. It is a prebiotic. It contains bifidobacterium. Next one, please. Then broccoli sprouts. Broccoli, as I mentioned earlier, is very important, very good for these conditions and for preventing also. But if you could take broccoli sprouts, they are even better because it is research has shown that when you take broccoli sprouts, it increases urinary secretion of benzene by 61%. And benzene, as you know, is very toxic to the brain. And whenever we go to a petrol bunk, we land up inhaling some of it. So if you keep taking broccoli sprouts, it is supposed to be very helpful. Next one, please. Vitamin D is again, as you know, very important. It has many, many functions in the body. One of them is repairing the gut. That is, it improves the action of zonulin. Zonulin is the protein which improves function of the tight junctions. So, and every cell in the body needs vitamin D. Next one, please. Then gut healing nutrients are probiotics, which best would be to take them from food itself, and also fish oils. The problem with fish oils is that most of them contain mercury, therefore it becomes a problem. So we have to be a little choosy about this. We should take omega-3 from that type of oil, which has come from fish, which have which their natural habitat is the Atlantic or deep ocean fish, or also coming from algae, which are now easily available. Because omega 3, what omega 3 you get from vegetarian and plant sources is not that effective. Most effective are the EPA and the DHEA, which are present in animal foods or fish oil. So vegetarians have a bit of a disadvantage here. Next slide, please. Then the natural substances which are helpful in neurodegenerative disorders. Next one, please. Now, fermented foods, which I've already mentioned, like charch, which we can have it at home, but made from hung curd. Kanji, which we make from carrots or cauliflower in winters. Coconut kefir. Coconut kefir is generally may not be available here, but if it is possible to get it, it is very effective. Fermented vegetables like cucumbers, kimchi, kombucha, olives, pickled ginger. Many of these are available in the West, but they can very easily be made in our homes if you know the technique. Next one, please. Curcumin, of course, is very important. I think everybody knows that. One of the reasons why Alzheimer's is not as common in India as compared to the West is this, because we consume healthy in practically every meal of ours. And turmeric has only 7% curcumin. Even then, it is quite preventive against Alzheimer's. It reduces inflammation. It protects our cells. Produces brain derived natural factor. Next slide, please. Next one, please. Then coming to adaptogens. Well, now this is something which I'm sure my colleagues are going to discuss in more detail. So I will not talk much about it, excepting for giving you some names. Next one, please. Adaptogens are non-toxic and they are very effective. The common ones are bacopa, ashwagandha, tulsi. Next one, please. Berries are very important for preventing. They're very good for the brain. Berries are very good. There are some more things which are good. Next one, please. Regular exercise, we know that it has a very important role to play as far as our entire body is concerned. So the brain is no exception. Next one, please. Intermittent fasting. Now, healthy fats is what the brain requires. The brain does not need the type of fat which we are pumping into it. It needs healthy fat. And healthy fat, the best form of fat is ketone. And this ketone is available when we do intermittent fasting, because then the fat content switches over to a different mode. Initially, for the first many hours, we are dependent on sugar as the fuel for the brain. But with intermittent fasting, it changes over to ketones, and ketones is what the brain loves. And intermittent fasting also reduces insulin resistance, corrects diabetes, hypertension, etc., which also indirectly help the brain function. Next one, please. Avocados. Avocado is the best fruit available for not only the brain but for us also, because this has a very healthy type of fat which is very good for us. Olives, extra virgin olive oil is very effective and should be consumed by all of us. Next one, please. Coconut. The coconut is assumed tremendous importance. Now, any form of the coconut excepting the coconut water. Coconut water we do not generally recommend, but if it has to be taken, you should take it with lime to prevent stone formation. Also, coconut water has a lot of sugar in it. Therefore, we don't recommend it for most of these type of patients. But coconut oil, that is virgin cold pressed coconut oil, this coconut oil can be taken in two forms, either directly as the cold pressed oil, or its other form called the MCT oil. The difference is the coconut oil has an effect for almost 8 hours, while the MCT oil peaks very fast, but the effect finishes off in a couple of hours. So if you take MCT oil, then you got to take it round the clock, which may become difficult. But coconut oil is extremely good for any of the brain conditions, both in preventing it as well as in helping to reverse it. Next one, please. Of the nuts, we are all aware. Walnuts, which look like the brain itself, as well as pistachio nuts, macadamia nuts. These three type of nuts are very good for brain function. Next one, please. Then yoga. Yoga, of course, is very important for every system of the body, both for the physical, the astral body, as well as the causal body. And of the important asanas, there is one which I want to, which most people may not be aware, is if you see this looks like children being punished in school, called Uthak Baitak. This has a very specific purpose because as you see, you cross your arms and you hold the earlobes on the two sides. Now, the earlobes are supposed to have acupressure points for the brain. So you stimulate that. So this basically just entails taking in a deep breath and sitting down, then coming up, and this you do keep doing a number of times. This is supposed to be very effective. In fact, the West has given it a name called super brain yoga. Though this comes from the south, where there's a Tamilian name for it, Thopu Karnam pose it is called. This is very effective, and I think all of us should learn and try to do it. Then, of course, you have Sarvangasana, Halasana, Vipreet Karni, etc., because they have a direct effect on the brain. They increase brain blood flow. Next slide, please. Then Surya Namaskar as well as Balasana, they are very effective for the brain. Next one, please. Vagal stimulation, you remember that the vagus nerve is important for gut health. So to improve gut health, you can do these face yoga through which stimulates the vagus nerve, and that is quite effective. We do it every day. Next slide, please. Face yoga, there's a very typical kriya called Kapol Vikasa Kriya. This is very good for the vagus nerve. Next one, please. Then Kapal Bhati Pranayam, Brahmari Pranayam, they are all good for the brain. Next one, please. Meditation has assumed tremendous importance. We know there are so many benefits of meditation, but there are some specific benefits as far as the brain is concerned. For example, it increases brain-derived neurotropic factor, which is necessary for regenerating healthy brain cells. We now know that the brain cells have neuroplasticity. That means they can regenerate. Brain activity can shift to different parts of the cortex. Long-term meditators have significant larger gray matter volume in them. Next one, please. Then it improves our presence, our awareness, brings about peace, and cuts down an overactive mind. Cuts down. You can get more on the link. Next one, please. Well, this is one study which is ongoing, and it has proved that lifestyle modifications are very good for preventing brain problems. This is called the finger study. And this study showed that there was an improvement of executive function by 83%. Executive function of the brain means your planning, how you execute it, your focus on things, and also it increased processing speed by 150%. So this is an extremely good study. It's a finished study, still going on, but uh, a lot of benefits have accrued from this. Next one, please. So finally, to conclude, to prevent dementia, we should eat a healthy diet and all colors of the rainbow because every single color gives us a different type of effect on the microbiome. Eat fresh, seasonal, natural, locally grown food, which naturopathy tells us. Plenty of greens like broccoli, cauliflower, cabbage, berries, avocados, ginger, garlic, onions, no refined, packed, packaged fast food, etc. No milk, no sugar, no corn, adequate and relaxing sleep, relaxation methods, exercise, high intensity walking, training, qigong, stay active, and of course, meditation. Thank you very much for being patient and sorry for the initial hiccups.
No problem. Many thanks, Dr. Kohli, for the uh, great insights on such a challenging topic. We all know that how dementia is kind of plaguing and kind of progresses into very serious complications like Alzheimer's and others. So, highlighting the other aspects also that it is not only the food habits but also a leaky gut, which also plays a very critical role. And I am very sure that doctors of both Ayurveda fraternity as well as allopathy fraternity would have been benefited immensely from your great insights on such a challenging topic. Thank you so much, Dr. Kohli. We also to have Mr. Suman Mukherjee, who's a senior GPM at Dabur India Limited. Suman, I will request him to take over this session and highlight some of the products that we have at Dabur. Over to you, Mr. Suman. Unmute, unmute, unmute.
Yeah.
Okay.
Can you hear me?
Yeah, yeah, very well.
Yeah. Okay. So first of all, thank you, Mr. Anuj, and thank you, Dr. Kohli, for the wonderful session. I was just hearing it, so it was really pleasure for us to actually listen to you and get so many insights about the topic, and I'm sure that all the doctors got a lot of benefit and learning from your session. So I won't take much time. I would just like to focus on one product which we have from our Dabur portfolio. And before just starting my presentation, let me just share my file so that everyone can see my presentation. Just give me a second. It's showing as uploading. Is there any way I can present this directly?
Yeah, Sumanta, you can directly go to share. You can click on share screen also. You can, click on
Okay.
share screen. So open the PPT in the system and share screen. Automatically, it will take up the screen.
But it's just uploading. Probably it will be done. Let me just wait for a
Okay,
few seconds.
sure, sure. In the meantime, for the all the doctors and Vaidyas who are listening, you can post your questions on YouTube, Facebook, and other channels that we are live on, so that Dr. Kohli can answer that, right? And I'm very sure many more questions are there.
Yeah. So can you see my screen?
Yeah,
Okay, great. So once again, I won't, as I said, that we won't take much time. Thank you for your patient listening. I think we have our expert session. We would like to sort of brief you regarding one of our flagship brand. That's called Dabur Stresscom. As Dr. Kohli was mentioning, this contains ashwagandha, and I'm very proud to say that we source the best quality ashwagandha, and which is much superior than other marketed ashwagandha which is available. So let me sort of take you to the background why we have introduced Stresscom in the market, and what is the relevance of Dabur Stresscom, especially in today's context. So as you see here, the work stress actually takes almost the maximum of millennials and Gen Zs, as we call the professionals. 84% of them actually suffer from stress, and this has come out in our some of the recent studies conducted by various institutional companies. The survey showed that 84% of the men and 79% of the women suffer from stress in India, and this is very relevant for today's sandwich generation, which we call between the age of 35 and 49, and even 50 plus. 64% of them are suffering from age related stress related disorders. Now, post COVID, this has gone multifold. I mean, we were just closely monitoring the Google trends and all, which is showing almost 4 times increase after the pandemic. And we all know the reason, because we were there locked up at our respective, home, and we could not go out for so many months. And then there was some lot of issues regarding our work, regarding our, what will happen to our individuals who are doing the businesses, and there were a lot of chaotic situation which has happened during the COVID time, and that has actually aggravated the stress and anxiety disorders. And this has come in the recent Google statistics also. The key search word, especially in India, even compared to global, the stress and anxiety as a key a search word has gone up almost 4 times. So this is a reason for worry. And I'm sure as a healthcare or the medical professionals, you will see and you are seeing a lot of patients who are coming up with the stress related disorders. So I think this is the background why we are, promoting and focusing stresscom more, because we feel that stresscom can help those patients who are actually coming to you with a lot of stress and anxiety related disorders. And let me sort of give you a kind of broad overview. We all know that stress increases the cortisol levels, and cortisol can lead to a lot of problems, starting from heart, diabetes, and erectile dysfunctions, a lot of other problem, obesity, anxiety. I mean, you name anything, the sleep related disorders, it can lead to a lot of health related consequences, which are even much more fatal and threatening. So I think cortisol is something which we all, as a healthcare professionals, when we actually treat our patient, our goal is to control that. And I think from the natural origin, stresscom is the answer for that. As Dr. Kohli was mentioning, this is rich in ashwagandha, which is an adaptogen, and this acts as reducing the serum cortisol level. And in addition to that, stresscom also possesses immunomodulatory actions, which helps us protect from infection, and stimulates the lymphocytes and the phagocytes, arrests the premature aging, has adaptogenic antioxidants and anti-inflammatory properties. So all in all, we always believe that stresscom can help a lot of patients who are not only suffering from the anxiety disorders, also some of the bigger, comorbid patients which we see in our day-to-day practice, like for an example, heart, diabetes patients, patients who are suffering from, erectile dysfunctions, a lot of other associated disorders, where you feel that the root cause is stress. There, I'm sure stresscom therapy will help those patients. So that is the reason we are basically urging, wherever you see that stress can lead to decrease in the immunity, and the patients are prone to infections. I think stresscom is the answer. We have done a lot of clinical trial with stresscom, but I'd like to showcase a couple of them to you. For an example, one we have done with chronic fatigue syndrome. Here we have recruited almost 86 individuals, and we have followed all the clinical trial protocols, the inclusion and the exclusion criteria. We have given 2 capsules per day for 8 to 12 weeks, and followed a 4 week interval. And you see here the result speaks for the brand. I mean, the outcome is very, very encouraging. So we have checked 3 main parameters basically. So one is the fatigue level. So 42 out of 46, they said that they have experienced a gradual reduction in their fatigue level. In addition to that, we have also seen headache, myalgia, and weakness, and we found stresscom did extremely well compared to placebo. At a score of mean score of 0 to 3, stresscom shown a very good increase actually. I mean, with 8 weeks and 12 weeks therapy. So this is one clinical trial where we feel a lot of confidence that stresscom can help with patients who are coming with chronic fatigue syndrome. In addition to that, I would like to show one more trial where we have done for general anxiety disorders, where we have recruited almost 155 subjects, and this was done is MGIMS hospital. And we have again followed all the clinical trial protocols, and the endpoint was measured in a Hamilton rating scale, which is very, very accredited. So again, on a if you see, we have followed all the inclusion and exclusion criterias, and the outcome is again very, very encouraging. So patients with general anxiety disorders, out of 155, if you see from a 12-week and the 8-week therapy point of view, there is a gradual reduction with the stresscom therapy compared to the other group, who are basically given as a kind of relaxation therapy, the You see this, the right one is the regular group which are on the relaxation therapy, the left one is the stress calm group, and there is a steep reduction in the general anxiety disorders. So what makes Stresscom unique is its manufacturing process. This is something which I want to highlight here, because you might have seen a lot of companies are coming to you and promoting their ashwagandha, but again we are very confident that the efficacy of Stresscom would be much superior compared to other ashwagandha. The reason behind this is the reason. You see, this Stresscom we follow a 7 step process during the manufacturing, which is much superior compared to what other company does. So they normally follow the regular tablet making process, which is very simple, whereas what we do is we use a lipid based technology. And because of this technology, what happens basically, you see there is a gradual and there is a much superior improvement in the absorption and the bioavailability of the capsule. So when a patient takes stress calm, the it absorbs fast. Not only absorbs fast, it actually crosses blood brain barrier much faster than the other ashwagandha tablet or other formulation which is available in the market. And thereby you see the in terms of relief, this is much superior compared to other marketed brands. So this is something which we want to highlight. And probably when you are recommending ashwagandha to your patients, I mean, please consider Stresscom, because I'm sure your patient will going to get a much better relief which you are looking for in case of general anxiety disorders and chronic fatigue syndromes or other stress related disorders. So, just in a nutshell, Stresscom contains ashwagandha 300 mg root extract. It is standardized, and we are very happy to share with you because of this lipid-based technology. I think all doctors across the country, whoever have used Stresscom and given Stresscom to their patients, they have given us very encouraging feedback. And that is the reason Stresscom is probably the number one brand in the Ayurvedic space in managing the stress anxiety disorders. And we are pretty confident that when you prescribe Stresscom to your patient, there will be a significant improvement in terms of overall outcome, even compared to some of the other marketed ashwagandha. So yes, as we were discussing, as Dr. Kohli has enlightened us with the dementia and the related aspects. So physical, mental stress, chronic fatigue syndromes, insomnia, the mild sleep disorders cases also. In many times, doctors have given us feedback. General weakness, low immunity. These are the cases where we would recommend you to try Stresscom to your patient. And Stresscom is also having a deep cavity technology, and by that, even if patient keeps it for longer time, the freshness of the capsule remains, and thereby the efficacy of the brand, that you will get a consistent efficacy irrespective of when your patient is using it. So thank you very much. So I want to share this with all of you. I think thanks for trusting Stresscom, and we would love your feedback and try Stresscom to larger patient, larger group, and give us a feedback. And thank you very much for your time. Keep using Stresscom. Thank you so much. Thank you, Dr. Kohli. Thank you, Mr. Anuj.
Thanks, Sumanta, for the beautiful analysis and in-depth kind of presentation about Stresscom as to how stress also plays a very critical role in kind of conditions like dementia. And I'm very sure Dr. Kohli highlighted, the connection as to how the stress and the lifestyle modifications and challenges lead to or kind of act as a precursor to such challenging conditions. We have opened up for the questions, and I'll request all the Vedyas and the doctors to kind of send us the questions. One of the questions, Dr. Kohli, that very commonly we see in the medical fraternity is that Alzheimer's as such or dementia as such does not have a very kind of a concrete solution. So I launched in Lundbeck a brand called as uh, 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 Abixa, which is memantine, right? So even after Mementin's kind of launch, even today, as you rightly said, that dementia cannot be treated. So how do we bridge that kind of white space in terms of the treatment, both from the Ayurveda space as well as from the allopathy space, sir?
This was the reason why I mentioned all the causes, because if you know what is the background of Alzheimer's or neurodegenerative conditions, at least those we can remove from one's life. So the continuous insult of those things, for example, uh, as I said, now gluten or wheat, these are important. These are bad for practically everybody. A lot of us have sensitivities to this. So if you stop wheat, if they are sensitive to gluten, you stop gluten altogether, 100%. Sugar, you need to stop. Alcohol, you need to stop. Rice. So all of these factors, and milk also. Now all of these are bad for you because there's a lot of mix up going on with these. We are not getting the right type of wheat as we used to have before. The milk also which we are getting, the type of casein which we have is very hard to digest. It is very, very difficult. It is bad for the brain. Similarly, rice, all too much of carbohydrates. So that is one. Then secondly, we have to check for the presence of any heavy metal, especially mercury, lead, cadmium. Now, all of these three are important in contributing brain dysfunction or dysfunction anywhere in the body. So, all the factors which cause leaky gut. So, across the board, we tell patients to stop these, you stop wheat, you stop milk, you stop sugar and sugar containing things. Also, you stop the use of refined foods, oils, packaged foods, preserved foods, fast foods. You reduce the intake of carbohydrates. If you can detect heavy metals, you got to chelate them and remove that out of the body. You got to check for inflammation, and the inflammatory markers are ESR, CRP, ferritin. So if you detect inflammation, you got to give an anti-inflammatory diet. Any other methods which you can apply to reduce inflammation. You got to detoxify the person completely. Even are going to have a great impact on a person's well-being slowly, because it is quite common to see diabetics, long-standing diabetics, start getting demented, start getting Alzheimer's or Parkinson's and all that. So all of these things need to be stopped. And I cannot stress enough on daily detoxification, which I mentioned before. Actually, detoxification has come from Ayurveda. Ayurveda talks of Panch Karma, and that has been slightly modified for a day and age. So that we have to keep doing continuously. So stop your exposure to pesticides, stop your exposure to fungicides, to any of these chemicals which are bad for you. Any of these, stop using perfume, stop using talcum powder. If at all you have to use something, use natural things which are all available. Stop using plastic completely. No plastic bottles, no plastic combs. None of these things should be used, should be present in the house. You stop using, uh, you know, uh, utensil like made of aluminium or things like that. The only utensils I advise are stainless steel or earthen utensils. Don't use any others. All Everything else is bad for you. So if you can cut down on all of these things, all the inflammatory factors, that itself is going to have a tremendous effect. And increase the intake of healthy foods and healthy fats. Increase the intake of ghee, increase the intake of cold pressed coconut oil. Coconut oil is extremely good and effective. Increase the intake of curcumin. Haldi does not have enough curcumin, but you can give curcumin from outside. The, I think many companies are making curcumin tablets and capsules. You can add that to the diet, but we have to remember that curcumin obviously is effective when it is given along with some fat, not with water. So these small things we need to remember, and we need to advocate all of them. Chelation plays a very important role if heavy metals have been detected. Now, as far as medicines are concerned, there are none. Now, what Dr. Bredzen is doing in his research, he has mapped out some 37 factors which generally cause problems. So they are doing a very extensive job. They are checking for lots of antibodies. Now, once you know the level of antibodies, and when you start effectively treating the patient on these lifestyle modifications, then you start seeing the antibody levels slowly come down. As the antibody levels start coming down, the patient's symptoms improve because occurrence of symptoms is a very late stage of the disease. So if you're treating a symptomatic patient, you've got to keep checking the antibodies. So this may become a little expensive to check all of those. But things like gluten and wheat and certain common antibodies we can always check. So I think that is the way to go about it. Now, if you are really interested, anyone is interested, they can go on Dr. Bredzen's site. He's written a very nice book also, and he's chalked out the entire details of what and how he does it. He may not mention all the 37 factors. Now, he keeps patients on different scales. Now, some may have maybe 11 out of 37. Some may have 30 factors out of 37. So, all of them need to be corrected. Merely correcting one or two may not be enough. So if you do it in a scientific manner, you check the antibody levels and resort to a type of a protocol as Dr. Bredzen has described, and then you can reverse it. So as I said, he's reversed more than 100 patients already of classical, symptomatic Alzheimer's disease, which is an extremely big achievement, I would say. We should have to learn from that.
Great, sir. So I think that's a very in-depth answer to such a challenging question. Sumanji, would you like to take one question from a doctor saying, what should be the dose of stress-com in a patient typically? Like if a patient comes to a doctor, so what
Right.
dose do we? Yeah.
Yeah, so it depends on the type of the condition. I mean, when patient is visiting, it might be a milder symptom, might be a severe cases. So again, I would request you to titrate the dosage depending on the type of disorders the patients are coming up with. But normally, what we recommend is 1 to 2 capsules. I mean, it can be taken during the bedtime, ideally, or even in the morning. Some of the doctors recommend. So 1 to 2 capsules in a day is the dosage. But I would strongly suggest, if the patient is having chronic disorders, the stress-com therapy has to be given between 8 to 12 weeks, and that's the trial what we have done. So I sincerely request you not to stop stress-com therapy after 7 days or 10 days. Instead of that, do it for 8 to 12 weeks for the most effective result, which we have experienced while doing the clinical trials as well.
Dr. Suman, are there any side effects to stress-com?
So,
Have you
doctor,
seen any?
yeah, I think that's a valid question. With the recommended therapy, we have not come across any type of side effects or the adverse effect, and as on date. And the Stresscom is having a clinical experience of more than 1.5 decades, so that gives us a lot of confidence that this brand works. I mean, even after a long-term therapy, we have seen patients who are taking Stresscom for 10 years and have never reported any side effects or any adverse effect.
I've been using it very routinely in most of the patients, and they are quite happy with this.
Yes, sir. So please do use it. I think your experience will also add to our confidence.
Yeah, I'm doing that. I'm doing using it for thyroid patients also.
Oh, that's wonderful. Okay.
Great, great. So I think we have come to the end of the webinar, and first of all, I'd like to thank from the Dabur India Limited and the Dabur family, Dr. Vijayman Kohli, for sparing his valuable time, sparing his time for such a challenging topic. Dr. Kohli, thank you so much, and we look
Welcome.
upon up to you for future webinars also, so that the entire doctor fraternity, both from the Ayurveda as well as allopathy, can be enriched by your tremendous knowledge that you have in terms of treating patients both at India and at various international acclaimed colleges and hospitals. So thank you, Dr. Kohli from the Dabur family. Also like to thank Mr. Suman Mukherjee for sparing his time and highlighting the importance of stress-com in such a challenging condition. Thank you, Suman Mukherjee. And from the Dabur India Limited, I'll also like to thank our digital partners, IndianVedyas.com, especially Dr. Piyush Juneja, for facilitating the entire seamless facilitation of the webinar on the various platforms. Thank you very much, and we'll see you
अनुज
next
जी
time.
अनुज जी एक मिनट एक क्वेश्चन आया एक डॉक्टर का प्लीज मैं स्क्रीन
And
पे शेयर कर रहा हूँ उसको प्लीज
can stress-com work on high BP such as hypertension case of high BP condition? Sumanda, would you like to take that?
Yeah. So, uh, you know, just to give you the perspective, we have clinical evidence and we have experience. A lot of doctors have actually shared with us they are using stresscom in in cardiac patients, in a lot of cardiac ailments. I think Dr. Kohli can also endorse that. But as a standalone therapy in high BP patients, we have not done any clinical evidence or to very confidently recommend that as a standalone therapy in high BP patients. But having said that, I would request Dr. Kohli if you can throw some light on it.
Yes, as far as hypertension is concerned, we did it last time, and of course, there are many reasons for that. So, those reasons, of course, have to be corrected, but stress always plays a role in hypertension. So, because stress is a factor behind it, therefore, stresscom becomes an important method of treating these patients. And of course, a stage may come when, if they have only stress as the predominant factor, other factors have been taken care of. So, stresscom can be continued for a longer period of time also. And as I've seen in my patients also, I'm quite happy, and patients also quite happy taking it.
I think that gives us a lot of confidence. Yeah. So thank you for sharing your feedback, Dr. Sir.
Thank you so much, Dr. Kohli. Thank you so much, Ji. And thank you, Indian Vedyas, especially Dr. Piyush, for facilitation of the webinar. We'll meet you next time for another interesting topic. Till then, from all of us from the Dabur family, stay safe, stay healthy. Thank you so much. Take care.
Thank you,
Thank you.
sir.
Thank you,
Thank you.
Dr.
Have a
Piyush, Dr.
nice. Thank
Suman,
you.
Dr. Anuj.
Thank you,
It was a
Dr.
pleasure.
Kohli. Thank
Goodbye.
you, Dr. Piyush.